And we are live.
All righty. Hi, folks. Welcome to another Katy Area Chamber of Commerce Webinar Wednesday. Today, as I'm sure you know because you're signing in here, is staying safe while traveling in a pandemic. And we are lucky to hear from Dr. Benedict Ifedi. Dr. Ifedi is with Memorial Hermann Medical Group. A real quick bio about him is he graduated from magna cum laude in a Bachelor of Science in Biochemistry from University of Houston. Go Cougs. Dr. Benedict Ifedi received his medical degree from Baylor College of Medicine in Houston. He went on to complete his family medical residency at Memorial Hermann Medicine Residency in Sugar Land, and he also served as the chief resident there. Afterwards, he completed a fellowship in sports medicine at Bayfront Health in St. Petersburg, Florida. He is board certified in family medicine and sports medicine and treats patients ages 5 and older, provides care for sports-related injuries such as strains, pulls, and concussions, as well as wellness and preventative medicine. His clinical interests include management of chronic diseases, exercise medicine, and physical activity. He is an active member of the American Academy of Family Physicians, American Medical Society for Sports Medicine, and the American College of Sports Medicine. So without further ado, Dr. Ifedi, please.
All right. Thank you for that introduction, Rick. I appreciate it. And welcome, everybody. We're going to hop right in. Basically, this talk is entitled Staying Safe While Traveling in a Pandemic. All right. There we go. So I wanted to start with this quote and this visual, which I think encompasses how we probably all feel right now in this pandemic. So embrace uncertainty. Some of the most beautiful chapters in our lives won't have a title until much later. So I think once we're past this pandemic, we'll look back on it. And I think it'll be a defining moment in a lot of our lives. And hopefully we've grown despite some of the adversity. And like the dog in this fire right now, we just have to say, this is fine. This is fine. So you want to travel in a pandemic. So the first question is COVID-19 spreading where I'm going? So one of the things I did was I looked up, if we're talking about traveling within the U.S., just what were the top 5 destinations by state. And according to the World Atlas in 2018, it was topped by California, then Florida, Nevada, Texas, where we live, and New York. And again, the biggest thing is knowing, is your destination is a hotspot? And it's not to say that you can't travel there, but it's something to keep in mind about the possibility of, contracting COVID-19. So this map is from the CDC website, and it basically kind of lists worldwide where they recommend that you can travel to. And, without getting into too much detail on this particular slide, the U.S. basically recommends against any non-essential international travel, which is why, everything is orange. So when we look at the state of New York, so on the left, I have a picture from about a month ago, around July 13th, compared to 3 days ago on the 2nd, when I pulled this from the CDC website. And when you look at New York, in the past 7 days, they've had about 2,600 cases in NYC, and then NY State had about 2,000, fairly similar to where they were last month as well. And at least, New York has been a lot less hot in the past several months, but initially we know they were the epicenter of the epidemic. And I'll kind of talk about it a little bit later, but New York and the tri-state area actually has or requires a 14-day quarantine for anyone from hotspots. And I'll kind of, give you what their definition of hotspots are. When we look at Texas, about a month ago, we had 63,000 cases in that previous 7 days. And as of August 2nd, we had 54,000 cases in the past 7 days. So improved, but things are still not quite where we want it to be in Texas. When you look at Nevada, obviously you have a lot of nice things in Nevada, including Vegas. About a month ago, there was 5,000 cases in the past 7 days. It's a little bit worse as of 3 days ago, 7,000 cases in the past 7 days. So, something to be cognizant of if you're traveling there. When you look at Florida, which I think arguably is kind of the new epicenter, between Texas and California, about a month ago, it was 70,000 cases in the past 70 days. Now it's 65,000 cases in the past 70 days. So not too bad. I know Disney World's recently opened up. That's where the NBA bubble is happening. So things are happening in Florida, just kind of in isolation. And when we look at California, about a month ago, they had 60,000 cases in the past 7 days. And then as of 3 days ago, 54,000 cases in the past 7 days. So some improvement there as well. So again, you can kind of do this for every state when you go on the CDC website, just to get an idea of, the total number of cases they've had as far as COVID-19, and then recent cases they've had, just to get an idea of how cautious you should be, if you're considering traveling to those areas. So the second question is COVID-19 prevalent in your community? And when we think about us in Houston and Texas at large, we know that we do have a big spread, but just to give some perspective, July 1st, it was 40,000 cases in the past 7 days, at least as of that date. On the 13th, that's where we started to have an uptick again, 63.5 thousand cases in the past 7 days. And as of 3 days ago, it's 54,000 cases in the past 7 days, like I said, so better, but we're still one of those places that's considered a hotspot. So a lot of other states probably don't want us traveling there, but it's not to say that you can't. The third question to ask yourself is, will you or those that you're traveling with be within 6 feet of others during or after your trip? So depending on the nature of your trip, whether it be outdoors, I know I've heard a lot of people do, camping, more outdoor type activities where you're able to socially distance. That's something to consider versus, obviously if you go to a New York City where there's a lot of tourist attractions, a lot of crowding, that's probably not an ideal scenario. And probably not really even available right now, because as I understand it, I think things are still pretty much closed as far as, when you think about plays, the different tourist attractions, et cetera, et cetera. The next bigger question is, are you or those that you're traveling with more likely to get ill from COVID-19? So the CDC kind of breaks down two different categories: increased risk and might be increased risk. So the one narrative that we know is that if you're an older adult, arguably greater than 65 years old, you're at increased risk of contracting COVID-19. So you should definitely heed some caution before considering traveling. If you have COPD or chronic obstructive pulmonary disease, especially if you're a smoker, if you're immunocompromised from an organ transplant, so kidney, liver, obesity, if you have a BMI greater than 30, which when you look at BMI is basically your weight divided by your height, meters squared. And interestingly enough, to kind of extrapolate that a little bit further, I think the reason why obesity is at increased risk is because when you're obese, you naturally have an increased risk of other medical problems, whether it be diabetes or high blood pressure, and then those naturally can put you at increased risk for COVID-19. Serious heart conditions, sickle cell disease, type 2 diabetes might be increased risk, moderate to severe asthma. Obviously, anything that compromises you from a long pulmonary aspect, that's of concern. Cerebrovascular disease, cystic fibrosis, also again, lungs, hypertension, bone marrow transplant, HIV, if you're on chronic steroids, especially if you have a rheumatologic condition, such as, if you have, Crohn's or polymyalgia rheumatica, or anything that you may be treated by a rheumatologist, liver disease, dementia, pregnancy, pulmonary fibrosis, smoking, thalassemia, which is a benign kind of blood disorder, and then type 1 diabetes. So all things to take into consideration. And then I just wanted to show this graphic that, and I found it kind of interesting that 8 out of 10 COVID-19 deaths, so, that's a metric that I think has a lot more weight than, the cases themselves, although the number of cases is important. 8 out of 10 deaths have been reported in adults 65 years or older. So, just kind of putting a little bit more weight that if you're 65 and you're thinking about traveling, just really, give it some consideration and weigh the risk and the potential benefits. And then this chart shows per 100,000 people, the number of hospitalizations that happen for each age group. And the one thing we know is that COVID-19 is a lot more forgiving in the younger population. So if you look at 0 through arguably 29, the numbers are pretty low. They start to increase as you get older, especially if you look at that 65 plus age. That's where the majority of the hospitalizations are happening. So question 5, do you live with someone more likely to get ill from COVID-19? So say if you're, going to leave an older parent or a grandparent at home and you're traveling, just know that if you travel somewhere, you could potentially get COVID-19. And, the one thing we worry about is that asymptomatic spread. I think that's still trying to be a little bit better understood, but we know that's one thing that I think has led to some of the community spread. So, be very cognizant of that. So this, and this is where we kind of go into what I was talking about with New York. So do the state or local government where you live or your destination require you to stay at home for 14 days after traveling? So the beginning of last month, New York, New Jersey, and Connecticut, they required travelers from states with significant community spread of COVID-19 to quarantine for 14 days. All that to say, if you're from a place of significant community spread, which Texas was definitely one of those, and you're planning on going to New York, you would basically have to stay in a hotel room for 14 days. So probably not even worth taking the trip. And they actually initiated travel enforcement at airports where they would have you fill out a specific form, about your state of origin, where you're going, where you're staying, and they were actually going to have compliance officers kind of make sure that you fill that out. And if you don't, you're at risk of being fined. So, everybody's taking it very seriously. And then this is the website on the CDC. Just kind of want to give a visual. It literally has every state's public health department listed. And when you go to each state, it'll let you know what are their policies if you're traveling from out of state, of what the requirements are, whether it be quarantine, whether you need to be tested. Interesting enough, I had at least a mutual friend who an individual is going to be traveling to Alaska. And I looked at Alaska's website and they require you to have a negative test 72 hours before traveling. And if you don't have the test results by the time you get to Alaska, you have to quarantine until you get those negative test results. So every state is a little bit different. And it's just important to know that information before you're taken by surprise and, be frustrated. And New York State. So I think as of June 25th, this was the long list of states, I think a total of 36 that are on that list, that if you travel from here to New York, you have to do that self-quarantine of 14 days. And what they base that off of is if you have a test positivity, so of the number of people tested, if more than 10% is positive in the past 7 days, then they consider that high risk, or if the number of positive cases exceeds 10 per 100,000 residents. What if I've been recently sick? So if you've been recently sick, whether, definitely if it's been for COVID-19, then, I would not recommend that you travel. If you've been sick from something else, again, I would probably not travel at least for, 14 days until you're completely symptom-free and back to 100%. And do not travel with anybody who's actively sick, just because, even if it's not COVID-19, it places them at increased risk, places others at increased risk of getting COVID-19 and some of the downstream complications from that. All right, so I'm traveling, Dr. Ifedi. There's nothing you can tell me. What do I need to do to make sure that I'm safe? Cool, I got the answers. So the first thing, as has been, kind of the message that has been said over and over again, is clean your hands often. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact, so maintaining that 6 feet of distance or 2 meters. Wear a mask or facial covering in public. Cover or cough all of your sneezes. If you're having to get food, try to pick it up through a drive-through or curbside services. Obviously now restaurants are back open, and I think if you are going to dine in a restaurant, I would still recommend, if you're able to have that outdoor patio option where you kind of have open, free-flowing air, that's more ideal than inside. But if it is inside, making sure that the restaurant has taken steps to maintain kind of 6 feet between tables or chairs, if you will. Clean and disinfect frequently touched surfaces as much as you can. So bring some Lysol wipes. I think there has been a shortage of some of those. I believe I saw an article where either Lysol or Clorox wipes won't be available till 2021, but there's different brands outside of Lysol. So, make sure to bring those and just continue to keep a pulse on your health. I always tell all my patients, you know yourself and your body better than anybody. The moment you start experiencing anything, don't downplay it. You rather be overcautious, especially in this, new normal that we're living in than to downplay it and then potentially have something adverse happen to you. So symptom monitoring, looking at cough, if you have a fever, chills, muscle aches or pains, shortness of breath or difficulty breathing, sore throat, loss of taste or smell, which has been really prominent in a lot of my patients that I've talked to who've had COVID. Also GI symptoms like diarrhea is something to be aware of. And then chest pain as well. So, all of those things, if you start having those symptoms, definitely give your doctor a call, consider getting tested, just to kind of make sure. So consideration for types of travel, when you look at the CDC website, and, I would agree to a big extent that there's no form of travel that's deemed safer than the other, whether you're talking about airplanes, cars, train, etc. But there's different ways to kind of navigate each of those travels to just make it safer if you do decide to travel. So with air travel, social distancing is difficult on crowded flights. I know there was some talk with airlines of leaving the middle seat available. I don't know if they're still doing that, but I know pretty much almost every major airline has required wearing of masks. So at least that's one preventative measure. And then just be mindful of the fact that spending time in security lines, especially close to people if the airport is crowded, could increase risk. And again, kind of wearing your mask, try to avoid touching surfaces. And then, that's how you mitigate the risk of getting COVID. And again, stay home if you're sick, don't travel. Bus or train travel. So, sitting in a bus, hard to socially distance. So that's where just wearing a mask, having your hand sanitizer, frequent hand washing is going to be very important. Car travel arguably is safer, especially if you're traveling with people that you know well or your family, because it's, just you and your family in the car. And really where you may have any risk is when you make those inevitable bathroom or food stops and, you're having to come in contact with people, potentially, objects, tables, doorknobs, things like that. And just be very mindful because there's a lot of things we do with our hands, touching our phones, doorknobs that we don't even think about. So just be mindful that, before or after you do those things, and especially if you're going to eat, to make sure that you wash your hands or you're sanitized before. RV travel, again, arguably a safer method because you're usually going to be traveling with people and where the risk that you encounter is if you're, stopping for food or bathroom breaks and just the people and the item that you may encounter there. Public transportation, I encourage you to stay up to date on that specific form of transportation, their services, their procedures, because everyone may not be at 100% capacity. If you're going to New York and wanting to ride the subway, make sure that the lines and the places that you're going to go are going to be there. Avoid touching surfaces if you can. If you're able to do things like touchless payment, that's ideal. And then hand hygiene. If you're traveling, I think everybody should probably have their personal hand sanitizer. Basically will be right along with your cell phone. Ride sharing apps, taxis, limos, avoid touching surfaces, avoid accepting any of the kind of free trinkets that sometimes people will give, whether it's Uber or Lyft, water, mints, candy. It's not that you don't trust them, but, better safe in this time that we are right now. Try to avoid the pooled rides where they could pick up other random people. So just have those individual rides with like you or somebody that you know. Sit in the back of the vehicle if you can. And if the driver is amenable, have them open up the windows just so you have free flowing air going through the vehicle instead of the same air circulated with the AC, just to improve that ventilation. And then hand hygiene again. So cruises, right now, CDC recommends all people defer any travel on cruise ships, including river cruises worldwide. I did a quick Google search when I updated this on Sunday, and I saw mention of, I think, a European cruise that was potentially going to start this past or sometime this month. For cruises, I would just say, avoid it right now like the plague, pun intended. That probably won't be something that's viable, until late in the year, early next year. And the CDC has a level 3 travel notice, which is, again, just avoid all non-essential travel on cruises. As we know, there was a lot of the big outbreaks initially on cruise ships as well. Shared bike, scooters, skateboards, micro mobility devices. These are, become more popular, especially if you go to cities like Austin. Just make sure to clean and disinfect. So this is where it's going to be valuable to have your own Lysol wipes, kind of wipe the handles down, bike seats, etc. Touchless payment when possible, which most of them usually have, and just maintaining that good hand hygiene. So kind of next big thing is anticipate your travel needs. So if you have, medical issues, something that you take medication for, make sure you get with your doc or your provider and have enough of your medication, because the worst thing that you would want to happen is you go somewhere and you're having to either go to an ER, urgent care, or try to find a new doctor. And, just to have that extra headache and that exposure, is just not worth it, especially on a trip that, we already have to be strategic about this new way of traveling. So get with your doc, have enough medication. Pack alcohol-based sanitizer, at least 60% alcohol. I know I've seen a lot of news recently about a lot of hand sanitizers that have, I think, methanol in it that's not recommended. So, really be mindful of the hand sanitizer that you're buying. Bring your cloth facial covering so you can wear in public. If you're going on a road trip, make sure to pack enough food and water. Take steps to protect yourself from COVID. When booking accommodations. So if you're staying at a hotel, make sure to ask them what things and efforts have they put in place to make sure that, you will be as safe as you can. I know, a lot of places are sanitizing, 3-4 times more than they normally do to kind of ensure and give people peace of mind that, hey, if you come here, for your spa vacation, you're going to be good. So just kind of follow up with them and hold those folks accountable. Check the hotel, their practices, minimize use of areas. This last bullet point, I know people ask is like, well, why even travel if I can't go to the pools or patios? And this is just kind of a general recommendation. I think it's okay to go to those different areas, whether it be break rooms, patios, dining areas, game rooms, pools, hot tubs, but just, make sure that there isn't significant crowding, that those safety measures of those respective facilities have been put in place that's going to keep you safe. So international travel. Right now, CDC recommends avoiding all non-essential international travel. As we looked at that early, very colored map, is just still very high risk. And I think a lot of countries as well, they're implementing a lot of travel restrictions and closing their borders. I think some are slowly opening back up, but if you do travel internationally, it's going to be very unpredictable if your flight itinerary gets changed around or canceled. So at least right now, the safe thing is if you're going to travel, probably domestic, within the United States is the best. But, I know some people have to travel, for reasons that are out of their control, but just be mindful of that. So I just wanted to touch a little bit on at least the various testing that's available. So you have and I kind of misspoke on this first slide. So the main test is the PCR, that's the nasal swab. And then the rapid test is the antigen test, which is also a nasal swab. And I think they have a blood version as well, and like a saliva version that you can have as well. But the two most common ones are the nasal swabs. One is PCR, one is antigen. And then the antibody test that basically just shows if you've had a past infection and if your body has developed antibodies to COVID-19. The one thing that we still really don't have a good grasp on is if you do have antibodies to COVID-19, does it protect you from a future infection? And if so, how much so? So it's reassuring to have antibodies, but it's not, basically don't have a false sense of comfort as if you're now invincible from COVID. And I just wanted to go through, areas where you can kind of find how and where to go to get tested. If you're in Harris County, readyharris.org. This is the main page. They basically have all the information of free testing sites. They have Walgreens listed, so you can find a place to get tested if you need to. With Fort Bend County, where I know, Katy's kind of like partly Harris, partly Fort Bend. They also have their website where it kind of has all the resources of where to go to get tested. And also here at Memorial Hermann, or at least with all the Memorial Hermann Medical Group clinics, we have the ability to order COVID-19 testing through our Memorial Hermann urgent cares. So usually I've had my patients have a consultation with me via virtual visit, in-person visit if appropriate, and we'll basically put the order in. We get you scheduled at a time slot to go to the urgent care, so you're not having to wait too long, get the test done, and on average it's kind of taking about 3 or 4 days for things to come back. So, you know, there's options and resources if you need to get tested. And pretty much all the information that I talked about today I got from the CDC, Centers of Disease Control and Prevention website. And that is all I have. Any questions?
Sure, wonderful stuff. Thank you, Dr. Ifedi. We do have a couple of questions. One that came up in the chat was, what is wrong with the menthol sanitizer and why would you not recommend it?
It's a good question. So I have not looked into it specifically, so I'm not going to speak on what I don't know for sure, but I know I've just seen a lot of reports about there being hand sanitizers that people would recommend against, but I'm going to look that up specifically, and I'll get back, you know, if there's I guess on the commerce page, we could post that answer once I get that to you. But I don't know for sure, I just know I've kind of seen some alarms about that.
Well, and along those lines, I saw an article that said there were over 100 hand sanitizers that are deemed dangerous. And I guess that falls in line with what you're talking about.
Right, yeah. And again, you know, that's something I haven't fleshed out in detail. And it's surprising that, you know, all these hand sanitizers, I'm curious, you know, what would make them dangerous. But I'll definitely find that out because, you know, if you're going to the store and, you know, in general, usually I'll just say, hey, buy hand sanitizer. You know, to kind of find out that they may not be effective in the way that we want it to or be harmful, you know, that's definitely what we don't want. So I'll definitely get some clarification on that.
Okay, so we have a question about, does CVS and Walgreens test the same, and are they as reliable as other testing places?
Yeah, it's a good question. So I don't, I know with CVS and Walgreens, I think they're both doing nasal swab testing. And then for the most part, I know most of the testing sites are doing the PCR testing similar to what we do. Different labs are kind of contracted during the testing. And what I know is that the FDA, for pretty much all of the COVID-19 testing, they allowed what's called emergency use authorization. So all of the testing didn't go through kind of the normal rigorousness of kind of making sure that they're very sensitive and specific, you know, in as many words, meaning they're accurate. So if we get a positive, it's most likely a positive. If we get a negative, it's most likely a negative. Even though they didn't go through those rigorous things. And I was trying to find the accuracy of all of the specific tests, but it's just not listed anywhere. They are confident that pretty much most of the testing have a 95% sensitivity, meaning it's gonna capture 95% of positives, and then that greater than 95% specificity, meaning that the tests that are positive, you can feel really reliable that it's positive, or the tests that are negative, you can feel really reliable that it's negative. And the one thing that I've kind of done anecdotally is take not only the test results, but also take it into context with the patient in front of me. So for example, I had a patient who tested positive about a month ago, had, you know, a lot of the classical symptoms, got better, was essentially 100%, tested negative a couple of times, and then had to test again for a procedure he was gonna have, and then tested positive. And, you know, again, symptom-free, absolutely symptom-free. And the surgeon was like, all right, you know, this seems like it may be a false positive. They retested him again with, I think, a rapid test, and it was negative. So all that to say, you know, kind of long and short of it is that most of the tests are pretty accurate. But then again, you know, I kind of take the test and also put it in the clinical scenario of the person who got tested. You know, because I've seen it where I had a patient, literally the only symptom they had was loss of smell. Otherwise was fantastic, and they tested positive for COVID. Whereas, you know, I've had people who've had, I think at least one person who've had all of the symptoms but tested negative, initially. And then, I basically wanted her to get retested. And I was like, yeah, you're positive until proven otherwise. I think she was a false negative. So long story short, most of the tests I think are pretty accurate, although, there's no, at least like good public database to kind of show like, all right, this specific test that Walgreens is using, is this accurate? The one that we use through Quest Lab, is this accurate? But for the most part, the FDA has kind of made sure that, if it's out there, it's going to be something we can rely on.
Great. Well, along with that testing, someone's asking about which test can produce results faster. I hear some are 2 weeks for results and other are just a few hours. So what's the difference there?
Yeah, so the rapid test results, I think, those ones are anywhere from, 30 minutes to a couple of hours. What I'll say is the results that seem like they're 2 weeks, they're truly not actually 2 weeks. They're probably, with the PCR test, which is the traditional test, it honestly probably takes all of about 2 to 3 days for it to truly result. But what's happened, especially with the increase in our amount of testing, and especially with there being a surge in Texas, is that the reporting has just been delayed. So a test that seemed like it took 2 weeks actually probably only took 3 to 4 days, but it just took them that long to kind of get it cranked out to like, all right, attach this test to this person and then get it back to the ordering provider and then inform the patient. So I think that's kind of been more of that lag. And I think overall, we're all trying to make a concerted effort to improve that. And that's where some of the intended contact tracing that we wanted to do has kind of, gone in thin air, because if it takes 2 weeks to get test results, either if you were at home quarantining during that time, that's great. But if you're out and about saying like, all right, I'm not sure if I'm positive, it defeats the purpose, because now not only have you been in contact with other people, but you may be in contact with new people.
Got it. Okay. Another question is, do you have a concern of the overlap of the COVID and upcoming flu season?
Yeah, great question. I would not be lying to you if I didn't tell you I had a little bit of trepidation about that. The first thing I'll say is I don't know. I don't know what's going to happen, but, it definitely does concern me, having to deal with COVID-19, with flu season, around the corner, usually starting end of September, early October, how that may impact things. And how we go about differentiating, what may be a flu, what may be a COVID, because there's, honestly, a lot of overlap between the symptoms. So it's one thing that I know, we as Memorial Hermann, and I think the health community at large is really going to be thinking hard about, how do we navigate that? How do we navigate what's, definitely going to be a challenge in that regard, whether it be, testing within the clinic. I know that's one thing that we eventually want to do. And I think from a testing standpoint, hopefully they'll develop a, point of care tests like those rapid tests that are available at some urgent cares and some hospitals that, we can use in clinic in the same way that we test for a strep throat or a flu, just to be able to get that information immediately. But then with that kind of comes, us being in full, personal protective equipment in the clinic, and how possible is that? So it's definitely a concern. And that's one thing that we're definitely trying to, figure out a solid plan day by day.
Okay. One last question, and this is a toughie. If you had your crystal ball, what are your thoughts on the timing of a vaccine? Because nobody knows.
Yeah. Man, if I had my crystal ball, I'm honestly just kind of going on, what I've seen in the media, some of the press conferences from the president. I think optimistically thinking, it'd probably be, somewhere around December, January. They're definitely pulling a ton of resources and moving much quicker than they normally would with the vaccine. So if I, take at face value, again, what I've heard from, the likes of the president, people like Dr. Fauci, it's probably December, January. And with that, the other tough thing is that, even with things like the flu vaccine, we know it's not 100% as far as its efficacy and its effectiveness. So that's also kind of a thing to be taken into account as well. But Optimistically speaking, hopefully we have that December, January really changes the game as far as how we're able to navigate and hopefully get back to some semblance of normalcy. I don't think we'll quite be back to, as I joked with somebody the other day, 100,000 people packing out Michigan Stadium, but, we're somewhere like halfway there, but we'll see.
Well, good. Great stuff. No more questions for now. This has been wonderful. I'm getting a lot of positive comments about it. Great information and very timely. And we just appreciate it. Dr. Ifedi, thank you so much. Thank you to Memorial Hermann for helping us organize this and for all that you all do for our community. And if there's no other questions, we'll end today and just say thank you and stay well.
All right. Thank you for having me. I appreciate it.
You betcha. All right. Thanks all.
Thank you.
Okay. There we go.
I think I stopped the share.
Still show that it's recording.